There are many correlations between having a healthy diet and the health of our eyes.
But there are also several unhealthy habits that can harm your eyes. Dr. Timothy Hodges from Hodges Eye Care is going to fill us in right now. Doctor, how are you?
Good morning.
Good morning.
Thanks for having me back.
Absolutely. Well, you bring such fascinating topics.
We've been talking about this all morning.
We have been.
And Doctor, tell us about, lately, one of the big issues is smoking. Tell us about how that can affect your eyesight.
Smoking can affect eyesight. It's the leading cause of macular degeneration. Macular degeneration is the leading cause of blindness in Americans over the age of 60. And I don't think there's a person over 60 that probably doesn't have either a relative, a family member, or a friend who's affected by macular degeneration. And unfortunately, almost every day, I make a new diagnosis of macular degeneration, which is a blinding eye condition. And what most patients don't know, and I'd almost venture to say almost every patient that I talk to is unaware of the fact that 40% of macular degeneration in this country is directly attributable to smoking. In other words, if you smoke, you virtually double your risk of having this blinding eye condition called macular degeneration. And if people would just stop, they would lower that risk. And of course, if they never stop, I mean, if they never start to begin with, then that would ultimately lower their risk. And it's never ceased to amaze me, and this has been for many years now. When I tell people this, they look at me in almost utter disbelief. They know they can get lung cancer.
Right.
They know they can have a stroke. They know they can have a heart attack. They know some of the killers of smoking. But they don't realize that they could actually go blind because they smoke.
Well, and I will admit, I was one of them.
Oh, yeah,
when I was reading through the paperwork on this segment, I was like, I haven't ever heard of this, and nor did I realize that smoking can cause blindness. What is it? Is it the nicotine? Is it the tar? Is it the smoke?
Well, smoking destroys small blood vessels.
Okay.
And that's what leads to the heart disease. That's what leads to some other disease in some of the other major organs, and what can cause strokes. But when you think about the eye, every blood vessel is small in the eye. So if you're destroying small blood vessels, then that's what can lead to the degeneration in the part of the eye that's called the macula. It just so happens that the macula happens to be an area in the eye where we have our best vision, but it's also where it's the highest rate of blood flow of any place in our body. And when you think about it, it makes sense because you've got these little cells in there, little rods and cones, we all learned in biology, and they're turning off and on based on light hitting them. So it's a very metabolic area, so that it has to have a lot of blood flow. And then when you smoke, you start to destroy those blood vessels, and then that causes the tissue to atrophy there. And then when there's not a blood flow or not a blood supply, of course the tissue dies, and that's what causes the blindness.
Now, for people that are smoking now, is it something that's, I don't know if reversible, but stopping, you can help improve the quality of your eyesight? Or future eye health, I should say.
Yes. Virtually every study that looks at cigarette smoking and disease, there is a benefit to stopping smoking, no matter how long you've smoked. So if I see somebody that's 65 years old with early macular degeneration, yes, it will benefit them if they stop. They shouldn't take this attitude of, I've done this for 25 years, what difference will it make? It's not going to matter now, and that's wrong. It will absolutely benefit them if they stop.
And what kind of smoker are we talking about? Are we talking about, the chain smokers that have 2 or 3 packs a day? Are we talking about people that casually smoke when they're with their friends and they're having cocktails? Are we talking about secondhand smoke? What really, I guess, are the perimeters for this?
I think the thing about cigarette smoking that everyone should remember is there is no safe cigarette. There is no safe amount to smoking. So whether they smoke 2 or 3 cigarettes a day or 2 packs a day, well, probably the 2-pack-a-day smoker is going to have more disease. But the person who's smoking only a few cigarettes a day is fooling themselves if they think that they're going to avoid significant risk.
One of the things we've seen lately that's become very popular are electronic cigarettes. Now, not many studies out because it's so new. Do we know if that is bad for your eyesight as well?
The jury's out on that, and I think we're watching a living experiment unfold right before our eyes. People think that the electronic cigarettes are safer because there's just maybe nicotine in there, but we really don't know. And I I think it's a habit that they should probably try to avoid right from the get-go.
And there are some people that have been smoking for years that could potentially just be in their early 40s and have been smoking for the last 20 years. Is there a way to test or come in and get tested to see if you are susceptible to this or if you're already on your way and they can stop? Or is it really something that only is determined when you're like 60 and older?
No, in every eye exam, a patient should be screened for macular degeneration.
Okay.
Now, it's generally a disease of the elderly. We're usually talking about people over 60. However, it does occasionally occur in younger people. You do occasionally see this in people that are over the age of 50, pretty rarely under the age of 50. But it's always screened for. And it's screened for just by examining that part of the eye with the instruments that we use to do a normal eye exam.
Wow. This is very eye-opening. It really is.
No pun intended, so to speak.
Yeah, exactly. But smoking can cause blindness. That is a very scary thing. And to know that you're doing it to yourself.
Well, and that's the thing. Now, we're on the topic of macular degeneration, easy for me to say. Are there other things that we can do to prevent, or is it just things like smoking that get in the way?
Well, smoking is the leading cause of macular degeneration. But people that don't smoke can still suffer from this condition as a function of aging. And they can protect themselves by a healthy diet, and a diet that's rich in green leafy vegetables. Green leafy vegetables have a pigment called lutein, and it turns out that lutein actually accumulates in the macula, and it protects the macula from oxidative stress from certain chemicals that are released while the little rods and cones are doing their thing so that we can see. There are supplements that you can take that have lutein. If you don't feel like you can eat enough spinach and kale, maybe that's not your deal. But you can take supplements, and they're very affordable. You can find them at any pharmacy. Certain antioxidant vitamins are probably beneficial also. And then just being healthy, controlling blood pressure, and not becoming diabetic, for example. That can protect the macula also.
Wow. Well, doctor, thank you so much for joining us today. I've learned some very, very important tips today.
This goes by so fast.
I know, doesn't it? And it's always so much fun.
I have such a good time talking to you guys.
Well, we
Thank
enjoy
you.
it too.
Thank you.
And improve your eye health and eyesight by calling Hodges Eye Care and Surgical Center at 326-4321 or go online to hodgeseyecare.com. Again, that number is 326-4321 and hodgeseyecare.com. And coming up right after the break, we'll head to an air-cooled movie to help you stay entertained and chilled while the temps are too hot to be outside.
Plus, home value goes up based on your home's curb appeal. So we've got some simple tips to improve your home from the outside. That's right after this.